Congratulations, CCGC, on your first 15 years of exciting, tremendously effective and successful programs. And I look forward to at least that many years to come.
Although we did not have the resources like national institutes had, we had a lot of participation and support. We started with a simple logo of a purple triangle for CCGC. We didn't have graphic support. And then at one point we didn't even have office space. And so we received a donated workstation at the Colorado Department of Public Health and Environment with computer equipment. So it was really nice that we had the support available to us.
The foundation of CCGC really arose out of development of guidelines where everyone could kind of focus on one particular disease entity and talk about what the best way providing care for individuals with particular diseases was. And I think that served as a wonderful foundation, an opportunity for folks to develop trust between themselves, among themselves, and between various organizations to allow us to go to the next level of really talking about the serious issues of how do we best provide health care across our state and across the country as a model to the rest of the country and the world.
You know, the New England Journal of Medicine landmark study that was published in 2003 stated that only 55% of the time physicians were following evidence-based guidelines for diseases such as diabetes. We've come a long way in the state of Colorado in improving those outcomes, and I think CCGC has had a great hand in that.
I think as IPIP evolved, we saw an explosion of the number of practices that were actually able to take guidelines and best practices and put them into action, and not only that, to take it to the next step in terms of developing an approach to the population of patients that they care for to really make meaningful impact.
CCGC was really ahead of the game several years ago by implementing IPIP, or Improving Performance in Practice. And I really see the IPIP movement that we implemented here in Colorado as really the first steps to moving toward a patient-centered medical home state.
The work that CCGC has done around practice redesign, both IPIP, the patient-centered medical home, and now the residency PCMH project, has really gotten a lot of attention across the whole country because we've been the pioneers oftentimes in leading the way into projects in those areas, and people are just very interested across the country in what's going on and what we're accomplishing.
Experts in the way of doing business as a patient-centered medical home, there are very few that I would rank up there with CCGC.
I think that CCGC plays a really critical role in furthering the conversation around system delivery reform. How do we provide more quality, better value care in the state of Colorado?
So my name is David Ehrenberger, and I have a special message for Marjorie Harbrecht, and that is that I'm very angry that now, after years of trying to figure out what CCGC means, stands for, I have to learn a new name.
Thinking back to what CCGC was just 5 years ago and looking at what it has now in terms of resources and opportunities, it's hard for me even to imagine where CCGC will be in 5 years, maybe owning the state or running the state. But I think that the best practice and what they've learned is so crucial to disseminate to other states and on a national basis. I think especially in this era of healthcare reform, when frankly everything is up in the air in healthcare today, the experiences of CCGC have been incredibly valuable. And we need to take those experiences and really spread them far and wide so that others can learn from them and benefit from them, and we can see the successful model replicated on a national basis.
So Margie, why are you guys changing your name?
Beside the fact no one can pronounce it?
Congratulations to okay, let me try again. Congratulations to the Colorado, okay, one more time.
I'm very proud to have been part of CCGC over the years.
Congratulations, CC. Try this again.
As far as CCGC's evolution over the past several years has gone, I think that a lot of us on the board have wondered, we're doing such great work, and does the name reflect really what we're doing? And initially, the Colorado Clinical Guidelines Collaborative accurately reflected everything that the organization was about, and yet over time it became clear that CCGC started to move in the space of healthcare transformation and making best practices not only available, but helping practices implement them and really incorporate them into the daily workflows. And I think as a result, the new name of Health Teamworks really more broadly encompasses what the organization truly does, and I think it also leaves room for what the organization is bound to do in the next several years.
Health Teamworks fits perfectly as a name and an image, as they are collaborative to the nth degree with regards to physician practices, patient care, being an advocate just for the system of healthcare. So good luck, and I can hardly wait to see how this rides out.
I love the name Health Teamworks, particularly the word team, because that's really what it's all about. As a patient and as a physician, nothing can get done effectively unless a team of people does it and does it well. So go team.
We are very excited for the future. With our new name and identity as Health Teamworks, that should be really great. But what we're most excited about is that the environment is changing to align perfectly with our ability to truly make some changes in health and healthcare. Seems like everything we've been doing over the last several years is finally going to come to fruition.
So, with the expansion of our mission to increase our impact, we got a lot of work to do.
No, you got a lot of work to do.
Bring it on.